Hello, hello. Thank you so much for tuning in today. Today I'm going to be focusing on sharing my experience with you on the double spinal fusion that I had in my C5 and C6 discs back in my spine earlier this year. It was March of 2021. It is now October, so it's been about 9 months of recovery time. And I'm going to share, kind of what led up to me having surgery, my background with, chronic pain, kind of give you some context, what some of my diagnoses have been, where I feel my diagnoses are still lacking, what it felt like, going into surgery, what it felt like coming out of surgery, what I've been able to do since, and if I would recommend it to those of you who are, maybe looking to have this surgery, or your doctor has recommended it and you're not sure if you should go that route. So please stick around. We're going to be talking about some great stuff. If you have any questions, concerns, want to chat, feel free to hit me up in the comments. Make sure you like this video if you get something out of it, and subscribe to my channel so that you get notifications when I drop future content. So let's go ahead and get started. Let me give you some context as to why I eventually ended up in surgery for a double spinal fusion. Now, I have never been in a serious car accident, and I have been seeking treatment for this pain since going back to around 2009. That's when it got bad enough to a point where I needed to seek professional treatment. Now, I was in my late 20s at that point. So to kind of give you some reflection of how young I was experiencing symptoms and pain that an old woman would experience, basically with your cartilage just kind of disintegrating. Now, the first doctor I went to was just kind of a standard primary doctor. He diagnosed me with degenerative disc disease, which after reading up on, I feel like that's kind of a generic that doctors tend to go to. It doesn't really tell you what caused, your cartilage to suddenly decide to not, act like it should, or to disintegrate, and where you've got bone rubbing up against bone and those kinds of things. I've also been diagnosed over the years with spinal arthritis, loose ligaments, kyphosis of the spine, where it's, there's that curvature of the spine. And my big deal is I still don't know what's causing all these things. All of these, diagnoses that they have given me so far are very much, symptomatic. These are the symptoms that you're having. They're called this. But nothing has been given to me as to what is it that's causing these symptoms. That's what I want to know, the causation. Is it something in my diet? Is it, my being at a desk all day, every day, which I guarantee you it has a lot to do with both of those things. But I still feel like there is some underlying medical cause, and it could be a connective tissue disease, like, some variation of Ehlers-Danlos. I can't say it. Y'all can look it up. So some things that I, tried in order. So I initially went to that primary care physician. He recommended me to go to a pain management doctor. I went down the path of opiates for several years, probably way too many years than I should have. Taking things like Percocet and OxyContin on a daily basis around the clock. And the problem with those medications is that they have very high highs and very low lows. And so right after you take it, it subsides the pain. You feel okay. You feel like you're able to, go about your day and be productive. The problem is, after an hour, that satisfaction, that relief from your chronic pain has gone away. And you're now stuck with 3 to 5 hours before you can take your next dose. And you feel like complete crap for those 3 to 5 hours. For those of you who have not, kind of been on that opiate bandwagon, or that opiate train that you just can't get off before. And so I was on that for a long, long time. And I'm not, ashamed to admit that when I couldn't go those, extra few hours, I would take more. And when you start taking more and you run out early, you have to find alternative means to relieve that pain. For me, it was never about getting high. I want to make that very clear. It was never about getting high. It was about this chronic, constant pain that never goes away. And it's not that it's like such an unbearable pain at any one point, like I'm being stabbed or, I can't perform my job duties. For me, it's been a very chronic and just steady pain. And it's primarily focused in my neck and shoulders. Now, mine has evolved over the years. I used to describe my pain as feeling as though my neck is a toothpick or a popsicle stick and my head is a bowling ball. And so it just felt like my head was way too heavy for my neck. Now I tend to describe my pain a little differently because it's more pronounced in the shoulder region. And I now describe it as it feels like I have a 14-year-old sitting on my shoulders all day, every day. And it's the constantness that is what is so hard to deal with from that perspective. When you have kind of an invisible disability like that, and that gnawing chronic pain that just never goes away. There have been days when, I would go into work and I can push through. I can be strong as heck, and nobody would guess that I have this pain at the back of my mind all day, every day. But as soon as I would get to my car, breakdown, tearworks, because it would become too much to handle. And I feel for my husband and my family because they're the only people that I feel comfortable complaining to. And sometimes you just have to complain. So if you can relate to that, let me know in the comments, because that is one thing that, I will never complain to people at work. I will rarely complain to friends. But my husband, my daughter, they get my complaining all day, every day. And I feel for them because they take the brunt of it. So let me talk about a few of the things that happened that kind of led up to the surgery. I initially saw a neurosurgeon probably 5 years into seeing that pain management doctor. And that surgeon recommended a double spinal fusion. Now, I did not listen to him. My father-in-law had actually had the exact same procedure about a year earlier, and his did not take. And he was actually left with more pain versus less pain after that surgery. And I think a big reason that happened was because he was smoking cigarettes. And when you smoke cigarettes, that bone cannot heal. It cannot merge. And so it's not going to work. The surgery is just not going to work, and you're going to be left with more pain. So if you are a smoker, a cigarette smoker, I highly urge you, do not do this surgery unless you're really serious about quitting. And I would recommend that you quit, at least 6 months before you ever go into the knife, because you do not want to be obviously left with more pain than what you had before. So I decided that, I didn't want to go under the knife at that point. I was going to try everything possible to try and mitigate that pain without going under the knife. And so I tried everything from, going to see the chiropractor twice weekly, getting medical massages, warm heat, physical therapy, and of course that medication management. And then I eventually decided that it was time to get off that opiate bandwagon and get on a alternative. And so I started researching alternatives and found Suboxone, or Buprenorphine. And what this is, it comes in a variety of delivery formats, but the most commonly used is a strip, and it kind of looks like the little Listerine strips. Now, in the United States, the FDA has only approved this medication for opiate abuse disorder. And so what that means is that in a lot of cases, it is only prescribed to people who have an opiate addiction, heroin addiction, any of those things. And what this medication does is it binds very strongly to your opiate receptors so that you get that pain relief. But if I were to try to take, a Percocet or an Oxycontin or something after taking the Suboxone, it wouldn't work because the Suboxone, or the Buprenorphine, which is the active ingredient in it, holds on so tightly. And then there's another medication in it, naloxone, which is what they use when there's a heroin overdose. You take, a dose of naloxone that can basically push that opiate off of the receptors. And so I researched this switch from opiates to Suboxone for 6 months before I ever pulled the trigger. It scared me to death. I mean, I'm giving up my crutch. I'm giving up my addiction. And it was not a light decision. And I will also say it was the best decision I've ever made in my entire life. The Suboxone, which I am still on today, so I'm a long-term Suboxone user, and I have rarely talked about this publicly because there is still a stigma, but the Suboxone makes it so that I am steady all day long. It has a very, very long half-life, and so instead of having those peaks and valleys where I feel great and then I feel like crap and then I feel great and then I feel like crap, instead of that, I'm just very level all day long. Now, it does not get rid of my pain. I'm still in pain all day long, but it makes my life bearable. It makes it so that I can be productive. I can work a job. I can sit at my desk all day long, followed up by, a heating pad and maybe a massage on the weekends and, doing some extra things. There are some negatives about Suboxone too, though. I mean, there's a lot of negatives if you read through, discussion forums and on Reddit. One of which is any kind of opiate is going to dry out your mouth, right? These are particular strips, like a Listerine strip that you put under your tongue or, in your lip right there. And they have a tendency to dry out your mouth. And with a lack of saliva, which I don't really feel like I have that. I honestly feel like a couple of the batches that I got of Suboxone, maybe a couple years ago, were highly acidic. I could honestly feel the difference between, one box to the next, that I may have gotten a formulation that was just off because I could feel it like hurting or burning kind of my gums. And I went from having 0 cavities at one dental checkup to 6 months later having 5 or 6 cavities. So literally it had eaten away my gums. And that was the only cavities I had, and I had been on Suboxone for at least 3 years at that point. So I really feel like it was just a bad batch. But Suboxone and other opiates do have the ability to dry out the saliva in the mouth. And when you don't have that kind of lubrication, you can get cavities. So either or, but I did not like the fact that I had 6 cavities. I'm not a dentist person. I hate the dentist. That's because I had TMJ in my early 20s and had to do some very, very aggressive surgery to fix that problem, which it is fixed. But it left me with forever fear of the dentist. So if I could go under the knife and hopefully get off of the Suboxone, that was my hope, that this surgery would work and then I could, gradually get off the Suboxone. So that was the plan. I saw a new neurosurgeon, and after talking to him, he recommended the exact same surgery that the initial neurosurgeon had recommended, several years prior. And so it's kind of getting 2, opinions over the course of several years. So I thought, okay, well, if 2 doctors are recommending this, then this is obviously what needs to happen. Well, I just got the call that I'm going to be going into surgery for my double spinal fusion in my neck on Monday morning at 4 a.m. So wish me luck. I'm scared. So kind of leading up to the surgery, I feel like I didn't really have a firm grasp on what I was about to experience and how I would feel. I started doing some digging, and the more digging I did and the more videos I watched and the more perspectives I watched, the more scared I got. And so I finally just kind of turned them off, and I said, I'm going to have the best mindset I can have, because if I go into this thinking that it's not going to work, it's not going to work. I honestly believe that. You have to go in with that mindset that this is going to work. I'm going to do everything that I'm supposed to do on my end. The doctor is going to do the best job he can on his end. He's a pro. And this is going to work. And I'm going to be able to gradually taper off the Suboxone, and my teeth aren't going to rot away out of my mouth, and I'm going to, be good. And so we showed up for surgery at 4 a.m. and, got me all through all the pre-op stuff and rolled me back. It's 3 a.m. and we're on our way to the hospital. Joey's driving me, and I am ready to do this. I do vividly remember how I felt when I woke up from the surgery, and that was that I had just how you feel like if you've just slept way too long. Maybe you've just been in bed for 3 days with the flu or whatever, but that backache that you get when you've been in bed for too long, just imagine that feeling times 10, times 100, I don't know. Now, how the surgery actually works, at least for me, with them going into my cervical spine, which is up, more towards here. I had my C5 through my C7 fused. They went in through the neck right here. So if you're having a lumbar surgery, they're going to go in probably through your lower spine. But I had mine right here. You can maybe not still see the scar. It's still pretty bad scar. My mother-in-law had the exact same surgery a week after me, and hers isn't noticeable at all. Of course, they put hers in a wrinkle, and I don't have the wrinkles yet, and so you can still see it a little bit. Since I was on Suboxone, that brings up a whole new thing, because surgery was terrifying to me. Absolutely terrifying, because they can't really give you anything after surgery. Now, while you're actually in surgery, they can give you some kind of designer drugs to make sure that you stay under and that your pain is managed. But the problem is, when you get out of surgery, you can't take the normal, opiate medication that they would normally give to a surgery patient, because the Suboxone, remember, has such a strong hold. Now, my doctor did recommend that I taper down as much as I could off the Suboxone before I went into surgery. And so I did get down to a smaller dose, and I did not take Suboxone the day of surgery. I took it the night before, and then, I just managed through it that morning. And so that, allowed me to, have some additional relief once I did come out of surgery. But at the same time, I felt like I wasn't getting that full, I think they gave me Percocet or something. I wasn't feeling that full amount of relief that I knew that the Suboxone would give. So pretty much as soon as I got out of surgery, instead of going with an opiate like the Percocet, I just decided to get back on my Suboxone, because I feel like it is honestly a better pain reliever than some of the other opiates, and I honestly didn't want to mess with any of the other opiates either. Out of surgery, I'm in a lot of pain, mostly in my back and shoulder blades. You can see my incision there. It hurts some too. It hurts when I swallow, but it's not terrible. We stuck with the Suboxone. It managed my pain fairly well. Definitely had to have a lot of ice packs, heat. I had to have somebody taking care of me and helping me just kind of get up and down out of the bed. It was really in my best interest to sleep as much as possible. So if you end up having the surgery, if CBD or THC gummies are legal in your state, highly, highly recommend. Get some that are good indica, good for sleeping, and just knock yourself out because you're not going to want to be awake.
This is me in a lot of pain. 2 days post-op. I'm having a hard time getting in front of it. I'm having really bad muscle spasms on either side. I'm just trying to go to sleep.
It is very painful, but it's doable. It's manageable, especially for somebody with chronic pain. And you've got, I believe that all people with chronic pain, have a high tolerance for pain. A lot of people view it as the opposite. You're constantly complaining. It's not that bad, blah, blah, blah. They don't understand what it's like to be in the shoes of somebody who never gets relief from chronic pain. And so I do believe that we have a very high tolerance for pain.
I do feel a little bit better today than I have. I'm outside, obviously, for the first time in several days. Still have a sore throat when I swallow. You can see what that looks like. It's been really hard to get comfortable. I was doing only ice, so no heat, because they specifically told me no heat. I guess ice is better for really helping the muscles and everything and all that tissue really heal, whereas heat just kind of relaxes everything, but relaxes it to the point where it can't heal. I don't know. But I discovered yesterday that heating pad is where it's at. It is like the only way I can get comfortable, and so now that I'm a few days post-op, I'm going to start integrating heating pad in to kind of help things.
So my particular doctor did not recommend, he did not put me in a collar. I know some people's doctors do. He also did not proactively recommend physical therapy. He basically told me, stay off work for, a week, maybe two, and see how you're feeling. And basically, you just can't pick anything heavy up. You can't, be jumping around on a trampoline. You can't be playing contact sports. Those were his, directions to me. So it was not a lot of limitations, and it was pretty free for me to, go back to work once I felt ready. I ended up taking adequate time off. I did not feel the need to go back to work after a week or two, but some of you might not be in the position to take off as long as I was able to.
All right, it is post-op day 9, I think, and today I feel pretty good. We're out going for a little stroll around the neighborhood. It's the first time I've put on a full face of makeup. Scar healing rather nicely. Day before yesterday, I also felt really good. Went for a walk. Did a lot of things around the house I probably shouldn't have. Overdid it. And then yesterday I was just completely miserable. So I'm expecting that tomorrow is going to be pretty bad because I was pretty active today, but we'll find out.
And so, like I said, he did not recommend physical therapy, but after, I'd say the main worst part of the pain, that post-surgical pain, went away after about a week. And then it just became kind of a gradual healing process. And as that gradual healing process progressed, the pain started to gradually decrease. But it got to a plateau. And it got to a plateau that was very similar to how I was pre-surgery. So basically I'd say that 3 months after the surgery, I was still experiencing the same amount of pain that I went in with, which was a problem, obviously. And so I brought up to the doctor that I would like to try physical therapy. And I ended up finding a fantastic physical therapist that really focused on spinal issues, post-spinal surgery recovery, and used a certain method that's used with a lot of scoliosis patients, where they really identify trigger points and loosening those trigger points before you're really building up the muscle. And so I did that twice or 3 times weekly, I can't remember, for about 3 months. And I also made changes to my diet. So this is something I've done in the past, where I try to switch over to a anti-inflammatory diet. And I do that by first limiting beef, pork, and chicken, because they keep me away from drive-thrus, which I'm terrible about. And then I gradually kind of cut out the other meat until I get to a really pescatarian type diet. I would call myself, because I've slipped recently, I would call myself now a reducitarian, instead of just fish and eggs being my main protein sources. I now do cheat with different meats at different times. Because I think that's, diets shouldn't be so strict that you can't stick to them. You need those little outs and those little treats every now and then, right? But changing my diet and getting rid of some of those inflammatory aspects and those inflammatory foods I was eating definitely helped. Physical therapy, beyond anything else I had tried, helped. The problem with physical therapy is that my pain relief always went away after I stopped physical therapy. This latest time, and when I've tried physical therapy in the past as well. The second I stop going regularly, the pain comes right back. So it's something that I constantly have to commit to. And I really need to set up a home exercise routine and look into something like the Iron Neck, which is a device that you can buy for your home to really strengthen these neck muscles. So how am I right now? Well, I would say that I am in just as much pain as I was prior to surgery. Now, mind you, I have not been doing physical therapy lately, so I know that if I was in physical therapy, and that if I really stuck to my anti-inflammatory diet, and not just the meat aspect, but incorporating more vegetables and healthy foods and getting rid of those heavily processed foods that go straight to that gut inflammatory response, that's something you should definitely research and look into, because all of the inflammation in our body comes from our gut and what we eat and what we put into it. And I wholeheartedly believe that. And so whenever I've done blood work, have high CR reactive protein, which is just an inflammation marker, just as I've got a lot of inflammation in my body. And so I don't know if there's another kind of diagnosis that needs to go along with that. But I know what helps, and it requires investment. And I'm such a workaholic, and I have all these little side projects and passions that I want to be involved in, and I tend to give my all to those things and maybe not to myself and my own health. And so I know that that's something I need to work on. Now, would I recommend this surgery for others? Would I recommend a spinal fusion or ACDF surgery? And I feel like that 100% depends on the person. I do not want to be the person that says, no, don't get one, it didn't work for me. But I feel like you need to research. Never do this as a first resort. This is not a first resort. But if you are willing to put in the physical therapy and make those lifestyle and dietary changes to really help the surgery to where it's, building blocks and you're not just relying on the surgery, then I feel like it can do a lot of help for a lot of people. Unfortunately, I've just talked to too many people that haven't had good results with this particular surgery. And I am curious to see what are the alternatives out there. If you are watching this video because your doctor has recommended this surgery, what other alternatives have you found in your research? And that's kind of a challenge to you, but also I'm curious to know because I'm still in pain and I don't know if I have other surgeries ahead of me in the future to help. And maybe they are more, innovative and newer surgeries where they're taking, advantage of newer technologies. So super curious about that. If you have any information along those lines, please leave it in the comments. I'm sure it will be helpful to others as well. If you have any questions or just want to chat, feel free to hit me up. I'm always available. And I hope that this has been helpful to anyone who may be looking at a double spinal fusion or a triple spinal fusion or a single spinal fusion or any of the spinal fusions or ACDF surgery. So thank you so much for tuning in. Please, if you got something out of this video, please hit that thumbs up or like button and subscribe to my channel so that you get notified when I drop future content. Thanks and have a wonderful day.